My name is Kathy Boehm, and I'm 71. When I lost all control of the bladder, it just really put restrictions on me even worse than they were, because you couldn't go anywhere, because you would ride in a car and you'd get up and you couldn't control your bladder. So if you didn't have an extra set of clothes with you, if I didn't plan it and wasn't aware of how long I was going to be gone, then I'd end up trying to find a restroom and usually didn't make it to the restroom. So that was hard for me because I'm a very active person. So to be able not to do the things that I did, or to go and say like to the parks with my grandkids, I couldn't do it. I had a cystocele and a rectocele, and my bladder had dropped totally out. After I had this procedure done in Orlando, it failed, and I think it lasted about 6 months because I got constant infections. It had to be taken out. They'd move it. It would come to the surface and push out, and then I would get another infection. So my options were either to go back or try someone new, and I kind of put word out where I live, and Dr. Garas' name was the one that came from almost everybody.
Traditionally, we will start with pelvic floor physical therapy and Kegels exercises. We'll also talk about dietary modifications, as a lot of their dietary intake can affect the bladder tremendously. And occasionally then we'll go on to medical management and try different medicines. The medicines do have side effects. There is a cost associated with the medications, but for the most part they're between 55 and 80% successful, and most people can do well with the combination of those three conservative measures. If, however, symptoms persist and somebody is still suffering from urge incontinence or overactive bladder, then we start getting onto some of the more nuanced treatments and more effective treatments, particularly sacral neuromodulation. Many patients with overactive bladder, the theory is that there is some disconnection between the bladder and the brain connection. The neuromodulator device is believed to help reconnect that connection between those body parts and then allow for a discontinuation of erroneous signals. In other words, signals that trigger the gotta go feeling or the sudden urgency that might actually be false signals. These devices help block that.
Saw Dr. Garas, we talked about it, and he mentioned Axonics, and at first I was a little nervous about it, but after talking to him and he explained it all, we decided to do it.
I will place a permanent lead under the skin. We will connect that to a small battery that's placed underneath the skin. The incision to place the battery is about 2 centimeters. No general anesthesia, you're home the same day, there's no real recovery. One of the newer advancements is that now patients have a battery choice. And there's 2 batteries that are available. There's a rechargeable battery, which is about this size, and then there is a non-rechargeable battery. The rechargeable battery needs to be recharged once every 6 months, and it takes about 20 minutes. And essentially, they would plug this device into the wall. Once this is fully charged, it gets placed in a belt and sits over the incision, and it will charge the internal battery. And again, that's once every 6 months. The battery has a life of between 15 and 20 years, at which point it takes about 5 to 7 minutes in the operating room to replace the battery. The other battery that's available is the more permanent battery, and this lasts between 20 and 25 years and requires no recharging at all. The other advantage now is the controller. So the patient, she can turn her device on and off, she can increase the stimulation.
And it is, I mean, I can raise and lower the strength of it.
One of the recent advancements with this new technology is that they are now all MRI compatible. So in the past, these devices would prohibit somebody from getting an MRI for whatever reason. However, these are now all currently MRI compatible.
And I go and do really whatever I want to do. I can go to malls, I can shop. When I walk my 4 miles, I don't have to base it upon where restrooms are. Basically, I'm This has taken care of all my incontinence, and now I don't even give it a second thought at all. Dr. Garas is very caring about how you live your life, and he's willing to try everything to get you back to a normal life. When you're his patient, it's as if you're his only patient.